This is the longitudinal X tape job, and you are going to have your patient sitting on the table with the foot extended off the table, 90 degrees plantar flexion. You are going to start, and you want to put a base strip across the transverse arch, so it's right there on the foot. This is going to go in an X formation, so you can start from the base of the first and work your way around, or from the base of the fifth and work your way around. I am going to start at the base of the first. You want to work your way down and around the heel and back up, ending at the base of the fifth, making sure that everything's good. I would have asked for a latex allergy and QDA, and apply QDA to the whole base of the foot around the top as well. If I'm going to start from the base of the first, my next strip is going to start from the base of the fifth, overlapping by half and around the base, the heel of the foot, and up. Ending at the base of the first, making sure that everything is still staying in place. My final third strip is going to start from the base of the first as well, again overlapping by half, going around the base of the heel, up and around, and ending at the base of the fifth. This is your X formation. You are going to want to close with another transverse tape. This is tying up any loose ends. You can also, to make sure that everything stays in place, use a Lodi technique. This is going to be using, I'm going to go from lateral pulling medial, pulling up medially, all the way down. This particular technique helps with pes cavus and plantar, as well as plantar fasciitis, and really it does anything that supports the longitudinal arch. So pull up, and it's going to end looking like that. You want to check the functionality of it and ask your patient how it feels. So how does it feel?
Feels alright.
Alright, and then you want to document how you did it, the feedback you got from your patient. You want to check the movement, so if he can move his foot. And you want to check cap refill to make sure that you didn't do anything. You want to ask your patient to stand up and walk to make sure that he has no limp or can properly walk. So how does that feel?
Feels alright.
Alright, so, and in the end, you want to document everything that you did, the feedback you got from your patient, and everything. You would discontinue this use if the patient no longer has pain, or if you have another idea as of like orthotics, personal orthotics that you can get to put into the patient's shoe. That's it.
Alright, next for this method is the knee hyperextension taping method. This
technique will be used when the athlete is having pain, especially in their quadricep area with hyperextension or extension of the knee. So what you're going to do is you're going to find the painful range of motion. So I'm going to ask my athlete to step up on this heel lift, and I'm going to bend, or ask him to bend his knee more, and then we're going to pull it back into extension to find where it hurts. So tell me where it hurts, right?
Right there.
Right there. So then when you find the painful range, and then go back forward a little bit, so flex knee a little bit more, and stay there. And then position your heel lift, so the individual can keep their knee in that position while you are applying the technique. Next, I would get some QDA for this individual to help with the anchors. And once again, for males or the people with hair on their legs, it's a good idea to put some pre-wrap on the area, or you can ask them to shave where you're going to be applying your anchors to keep the irritation from occurring. So you're going to apply your anchors applying the pre-wrap.
Alright.
Next, we're gonna apply the distal anger. I'm gonna say about the mid calf, mid of the leg. And once again,
Go
overlapping by about half. Then I will get my 3-inch elastic wrap and apply my anchors with it. So use moderate roll tension while going around. Then anchoring it on the leg. Continuing. Once again. As you can see up here, I did anchor this directly to the skin just for a better stick. Then I'll proceed to do the same distally. Apply anchor strips. Let's go ahead and put one more on down here. Make sure we get it low enough. So from here, next we are going to come around to the back of the leg.
Let's have your athlete face you.
And so we are going to take this and anchor it to the bottom. And then I'm going to stretch out the tape and see how, and go about 3/4 of the way in just of the stretch of it, and see where I want to anchor it, and then come back, and I'll just cut the tape right here, because you want to have high tension on this band, so you can keep this knee from hyperextending. I will also go ahead at this point and take a heel and lace pad and anchor it to the tape to cover this popliteal space right here to keep irritation from occurring. And hold on, pause it right there. So now after we apply this first one, we're going to apply our next strip. And so we're going to start on the medial aspect of the lower leg, and we're going to cross, and so you're going to anchor it there. We're going to, and we want to cross right at the popliteal fossa, and then anchor on the lateral side, and we want that to be about 3/4 tension. So I'm going to go ahead and measure it out and bring it back into its normal state and cut it. So now I'm going to apply it. I'll bring it across. anchoring it on the lateral side. We're going to do the same, but we're going to begin on the lateral side. Okay. I want to begin here on the lateral side. Measure it out, about 70%. Bring it back. Cut it. And then bring it up, anchoring it approximately. Bring it across the space. We don't want any wrinkles here. So we can see how this is covering the popliteal fossa back here. And then we're going to go now and close it up. So applying closure distally and proximally. Also making sure that we don't roll too tight around the belly of the gastroc or the thigh, just so the hamstrings, the quads, and all the lower leg muscles don't become too constricted from the tape being too tight. And there you go.